powerful crowd here today in Drogheda in support of the citizens here in St Joseph's home in RD and here in the Cottage Hospital. And I think people were really buoyed up to see so many of their friends and neighbours out in support of this very, very essential public nursing home. So I want again to commend the staff, everybody associated, the action group, all the people who come out today, but very, very particularly the people, the patients, the citizens who are in these two public nursing homes. And we need to keep the pressure up, and all of the local TDs, and we make no apologies for saying that the government TDs who have access to the ministers need to be ensuring that these two fine institutions are kept open.
The rally today was a huge success. It was the first of many plan of actions for the campaign. There were several thousand people that had taken to the streets of Drogheda to voice their concerns and indeed their anger at the government's intention to close the Cottage Hospital in Drogheda and indeed St Joseph's Hospital in RD. We had the committee. I'm a member of the committee. I'm secretary for the Save Drogheda Cottage Hospital Action Group, and we put forward a pledge today to ask all of our 5 TDs representing us in Louth and Leinster House to sign that pledge. It was a pledge of support, a very straightforward pledge of support for the retention of the Cottage Hospital and the retention of the provision of public services and care for our elderly. 2 of our TDs signed the pledge and gave that wholehearted commitment to the people of Drogheda and South Louth. Unfortunately, 3 of our TDs, 3 government TDs, could not give the same commitment to the people of Drogheda, which is extremely unfortunate. They're pursuing the agenda of the privatisation of our public healthcare system, and the people of the town today left them in no uncertain terms that they'll not put up with that, and we resist it at every opportunity. Today was the first of many, as I say. We in Sinn Féin are going to use what power we have in Leinster House. We're going to put priority questions to the Minister. We're going to raise the issue of the Cottage Hospital and indeed St Joseph's as a matter of priority in Leinster House, and the campaign committee will meet in the middle of next week, and we'll take it to the next stage from there. But as I said, this is only the start of the campaign, and we were hoping today to see a huge support from the town. We got that, and that was our endorsement to continue with this campaign.
The Bishop go han Broadwell. The Bay Libsha or an Ardon Shaw, because it's Chinu and Farogra Shaw, because the Bay Libsha in Cussant or Suranik Easta, San Oherlan Cottage, because in Nave Shasu in RD. As you may know, I'm not from Drogheda, but I was elected by the people of Drogheda, and I have to say, right across this county of Louth, the age-friendly county, I've been given a wonderful welcome by people who didn't vote for me, but who respect the work that we're trying to do. Public nursing homes are an essential part of the public service. The work that's been done in the Cottage Hospital, I listened to our 2 doctor friends, and I was there recently and met and saw for myself. The work that's been done up in St Joseph's in RD is a vocational work, and not only the citizens who are there, our elderly citizens, But the nursing staff, the health workers, the doctors, the cleaners, the catering staff, all deserve our support. I met a number of people up in St. Joseph's, and one woman particularly struck me, a woman called Mary Carroll. She told me that she was 104. Some people told me she's only 96. But either way, in 1916, she was alive, either as a child of 10 or a younger child. And what happened in 1916? A republic was declared. And who is key in a republic? Citizens. And what's the mark of a republic? That they will cherish all the children of the nation equally.
Next week they're going to get 1.25 billion euros to unguaranteed bondholders. Next month they're going to pay another 3 billion to Anglo-Irish, which is a criminal bank. And they're going to do that for the next 8 or 9 years. The sum total of all of that will be 65 billion that they're going to pay out. Think of how even a fraction of that money could be spent in the health services. They have choices to make. They take all the wrong choices. They take 500,000 home health bars of people who need it, and yet they let their friends, the big bankers and the bondholders, just take the people's money.
The cottage hospital is ours. How dare they try to take it away? How could they close the hospital? That's a fine hospital. And talk about spending millions on building another one, which they would privatise.